So this man's just had a ultrasound guided carpal tunnel release. We're going to do bilateral surgery. We've done the right side. We've released the transverse carpal ligament using a hook blade through a pinhole incision. And you can see the patient's wide awake and they're able to move their hand. Just make a fist for us, sir. Everything's working post-operatively. How did you go with that? All right, good, excellent. And now we'll do the other side. Positioning the patient so we've got them in the best position for the surgery. So I'm just going to scan your anatomy again, sir. You'll see the nerve dilating. So there's the nerve there. Just scanning the median nerve there now, demonstrating compression within the carpal tunnel. And he has a classical hourglass constriction deformity of the nerve, which is pathognomonic of carpal tunnel syndrome. Okay, we're just marking the anatomy, marking our entry point here. Just keep still for us, sir, if you can. And now we're going to identify at-risk vascular structures. This is the superficial palmar arch. And we're marking incision path with an indelible marker. That won't come off with the prep. And that's our incision path there. So we're going to put some cold air on the skin now, sir, just to numb the skin a little bit. Putting some local anaesthetic into the carpal tunnel now. Documenting how tight it is in there. You can see that it's not opening up at all as we inject the local anaesthetic into the carpal tunnel. See, once again, we're using sodium bicarb with adrenaline in our local anaesthesia to minimise pain. Okay, so we're coming back above the ligament now. The needle is going above the ligament and below the superficial palmar fascia. It's dissecting off the ligament quite nicely there. It's a nice picture there of the dissection off the ligament, preserving the superficial palmar fascia above. So we're just putting a sterile ultrasound probe cover on the ultrasound probe. So this allows us to do the surgery without contaminating the field. So just making a small skin incision there with a 19 gauge needle, 18 gauge blunt. So we now use an 18 gauge blunt drawing up needle. So we're just checking where the nerve is there, using a artery forceps now just to dilate that wound a little bit. Okay, so now we're going to put the hook blade into the carpal tunnel. You can see it there. There's the blade between the nerve and the artery. So we're in a safe zone. Cutting away from the nerve and the artery. Okay, so I'm pretty happy with that. And we've divided the ligament partially and the nerve and artery are separated, which is making it a little bit easier for me now. Okay, we're just staying away from the artery there. And now we're going to cut the last few fibres of the ligament. See, it's cutting the ligament there. Swab there, please. So just fine-tuning the release of the ligament there, just dividing them and protecting the superficial palmar fascia. And you can actually see there we've cut the ligament. You can see the device passing through the region where the ligament was intact. Now it seems to be divided. Okay, let's have the wash tanks. This is a critical part of the procedure. We demonstrate that we've fully decompressed the carpal tunnel. And you can see there that it's fully opening up there, so I'm pretty happy with that. Make your fist excellent. So we're just getting some of that fluid out of the carpal tunnel now. Bend your wrist for me. And now we're going to put some cortisone into the carpal tunnel. Bend your thumb for me. Bend all your fingers for me, make a full fist, so everything's working. Fantastic. Okay, so now we're going to put some cortisone into the carpal tunnel. Okay, we're going to put a dressing on now. Just going to put a little band-aid on that. You can see there's a tiny little wound there. Now we're going to put a stereo strip on there and a opposite dressing. Now we're putting a bandage on there. We'll put a wool underlay. Putting a crepe bandage on fairly lightly. And this stays on till tomorrow. And then we'll put a cohesive bandage over the top to minimise any bleeding. And that comes off in a couple of hours' time. Okay, let's have Coban. So we'll take off all these drapes now. So it all went very well. So tomorrow this comes off. First thing in the morning when you wake up. And then you can check the dressings. This layer here stays on for a couple of hours. Okay, we've just done bilateral ultrasound guided carpal tunnel releases on this gentleman. It's gone extremely well. He should recover to activities of normal living within about 5 days' time. The rehab will be minimal as opposed to traditional surgery. He should make a full neurological recovery as expected. Very happy with that outcome.